Although human beings are fully sexually differentiated at birth, the differences between males and females are accentuated at puberty. This is when the reproductive system matures. Secondary sexual characteristics develop, and the bodies of males and females appear more distinctive. Female puberty usually begins about 8-13 years of age. The reproduction maturation of boys lags about 2 years behind that of the girls. Physical changes of female puberty include breast development, rounding of the hips and buttocks, growth of the hair in the pubic region, in the underarm, and the start of the menstruation.
How does one ovulate? The major landmark of puberty among females is the onset of the menstrual cycle. The monthly ovulation cycle that leads to menstruation, the loss of blood and tissues lining the uterus, in the absence of pregnancy. The menstrual cycle is from the first day of a period until the day before the next period starts. Normally, it lasts around 28 days on the average, but can be as short as 21 or as long as 40. Whatever the length, ovulation will happen about 10 to 16 days before the start of the next period.
How does pregnancy occur? For pregnancy to proceed, the sperm needs to meet up with an egg. Pregnancy officially starts when a fertilized egg implants in the lining of the uterus. Pregnancy happens 2 to 3 weeks after sexual intercourse. This is redundant, so it was reducted. Conception is the process that begins with fertilization of an egg by the sperm and ends with implantation. When a male and female have a sexual intercourse, the penis fits into the woman's vagina. Ejaculation upcoming releases the sperm via the penis into the vagina. The sperm swims through the female's cervix, into the womb, and finally into the fallopian tubes. Once the egg or ovum has been released into the fallopian tube, hundreds of sperm swim up to reach it. Finally, the sperm penetrates the egg into the fallopian tube where fertilization takes place and eventually becomes an embryo. Once the embryo or fertilized egg attaches to the inner lining of the uterus or endothelium, a fetus develops within 5 to 7 days from a ball of cells floating in the uterus, which officially begins pregnancy. A normal pregnancy lasts 37 to 42 weeks or 9 months. This is measured from the first day of the last period. Pregnancy is discussed in terms of trimesters or 3-month periods, since each trimester is very different from the rest. After 8 weeks, the embryo is officially referred to as a fetus.
What can be done to prevent teenage pregnancy? Teen pregnancy has a tremendous impact on educational, social, and economic lives of young people. Early parenting reduces the likelihood that a young woman will complete high school and pursue the necessary post-secondary education needed to compete in today's economy. Although there is a decline in teenage pregnancy rates, it has been steady over the past 2 decades. Teens are still engaging in sexual activity, and teen girls are still getting pregnant.
Charts for contraception.
Male condom, rubber sheet that fits over the penis, rolled over the penis, 80 to 85%. Low cost, easily accessible, and reduces risk of STDs and STIs. Do not use with oil-based lubricants such as creams and lotions. Can be effective in prevention of STIs and HIV or AIDS. expandable hormone device, continuous release of hormones, continuous release of hormones, not known, continuous birth control for 5 years, implant of the capsule in the upper arm done by the doctor, and none. Calendar method, woman predicts the day of ovulation by keeping a calendar of the length of each menstrual cycle. Allows woman to keep track of safe days for sex. Theoretically 85%, but in reality about 60%. No cost under the control of the woman. Woman must keep track with the help of a calendar. And next is none. Sterilization, vasectomy for males and tubal ligation for females. Passageway for the sperm or the egg is surgically tied. Next is theoretically 100%, but exceptions have been known to take place. Highly effective, permanent, and one-time expense. Doctor performs an operation, and next is none.
Types of contraceptive method: withdrawal, removal of the penis from the vagina before ejaculation. How it works: prevent the semen from going into the vagina. Effectiveness: theoretically 85%, but in reality about 70%. Benefits: no cost under the control of the man and the woman alone. Instruction for use depends on the man. Benefits other than contraceptions: none. Types of contraceptive methods: birth control injection, given in the first day of the menstruations and then every 3 months. Effectiveness: not known. Instruction for use given by the doctors. Benefits other than contraceptions: none. Type of contraceptive method: intrauterine device IUD. How it works: inserted inside the uterus by a doctor. Effectiveness: theoretically 95 to 98%. Benefits: long-lasting and relatively inexpensive. Instruction for use: inserted by the doctor in the first few days of menstruation. Should be examined every few months. Benefit other than conception: none. Types of contraceptive method: birth control pill contains synthetic estrogen. How it works: alters natural ovulation cycle. Effectiveness: theoretically 99 to 100%, but women have conceived on the pill. Benefits: low cost, easily available, and controlled by the woman. Instruction for use: takes daily after menstrual cycles begins. Benefits other than contraceptions: none.
What are the health effects of early pregnancy in the growing adolescents? There are serious health risks associated with early pregnancy because a young woman's body is not mature enough to handle bearing a child. When a woman is under 20, the pelvic area or the bone surrounding the birth canal is still growing and may not be large enough to allow the baby to easily pass through the birth canal. This can result in what is called an obstructed labor. Obstructed labor is dangerous to both the mother and child and requires the help of trained medical professionals. Under the circumstances, the young woman will have an operation called a cesarean section, in which a cut is made in the abdomen and the baby is removed directly from the uterus. A major contributor to high maternal mortality rates is adolescent pregnancy. If a young woman is not physically mature, the uterus may tear during the birth process, and she may die because of blood loss. If she is lucky and survives the delivery, she might face fistula due to prolonged labor. A baby's head can also tear the vagina, causing a hole between the vagina and bladder or between the vagina and the rectum, resulting in what is known as fistula. Unless she has an operation to fix her problem for the rest of her life, she will not be able to hold her urine or feces, and this will make her a social outcast. In addition, Younger women who become pregnant face a higher risk than older women in developing a number of other complications. These complications can be any or a combination of the following manifestations: excessive vomiting, severe anemia, hypertension, convulsions, difficulty in breastfeeding, or if the girl is too young to produce milk, premature and low birth weight babies, infection, prolonged labor, and high maternal mortality or death. The risk of having serious complications during pregnancy or childbirth is much higher for girls in their early teens than for older women. Ages of 20 to 30 years are the safest period of women's life for childbearing. The major difference between girls in their early teens and older women is that girls aged 12 to 16 years are still growing. The pelvis or the bony birth canal of a girl can grow wider by as much as 20% between the time she begins menstruating and the time she is 16 years old. This widening of the pelvis can make the crucial difference between a safe delivery and obstructed labor. It is not surprising, therefore, to find that obstructed labor, due to this proportion between the size of the infant's head and the mother's pelvis, is most common among very young mothers. The consequences of such obstructed labor may be death due to numerous complications or lifetime crippling conditions of vesico-vaginal fistula.
Summary of the process of reproduction. Reproduction involves the ova or the egg of a female in the sperm of a male to fuse, and their union can lead to the creation of a new life through pregnancy. A normal pregnancy lasts for at least 37 to 42 weeks or 9 months. This is measured from the first day of the last period. In this lesson, we also explored the process of pregnancy or how does pregnancy occur, and the changes, risks, and complications that happen during pregnancy. For example, one of the risks during pregnancy is obstructed labor that is dangerous for both mother and the child, and that in a younger woman who become pregnant face a higher risk than older women in developing a number of other complications. These complications can be any or a combination of the following manifestations, such as excessive vomiting, severe anemia, convulsions, and etc. We also discussed the various ways of preventing pregnancy. For example, using contraceptions or condom, taking birth control pills, and also the calendar method, where a woman predicts the day of ovulation by keeping a calendar of the length or each menstrual cycle. In this lesson helps adolescents avoid teenage pregnancy or help younger women to be aware of the risk of teenage pregnancy so that the growing adolescent would be empowered to choose to avert from early pregnancy that can lead to various life-threatening complications. And that's all. Thank you.